Welcome to the School of Education and Human Development's Dean's Dialogue series, a podcast where we dive deep into the intersections of mental health, education, and public well-being. I'm Evelyn Bilius-Lolis, the Dean of the School of Education and Human Development at Fairfield University. And today we're tackling a topic that's quietly affecting millions of lives, maybe even yours, the loneliness epidemic. Let me start with this. You can be surrounded by people and still feel lonely. You can be in a partnership, a relationship, and still feel lonely. You can be completely alone and not feel lonely at all. At its core, loneliness isn't about the number of people in your life. It's about disconnection, feeling alone in your experience of the world, despite your proximity or access to others. But why is this personal experience now being called a public health crisis? Why has the former U.S. Surgeon General declared loneliness an epidemic? And how do we distinguish between the pain of loneliness and the peace of solitude? Today we'll unpack all that and more with two incredible guests, a public health scholar and professor, and a clinical psychologist and assistant dean of students, both on the front lines, helping students navigate feelings of disconnection in a hyper-connected world. Help me welcome Dr. Anthony Santella, a professor of public health and the director of the Master of Public Health at Fairfield University, and Dr. Clenisha Johnson, the assistant dean of students for Fairfield University. Dr. Santella's research helps improve the health and well-being of vulnerable communities, including people who are living with and at risk for HIV and viral hepatitis, gender and sexual minorities, justice-involved persons, youth, and people experiencing homelessness. As the Assistant Dean of Students, Dr. Clenisha Johnson leverages her background as a clinical psychologist to provide holistic support to students navigating academic and social-emotional challenges. She is dedicated to promoting mental health as well as racial and social justice through collaborations with various campus groups and partners. Before her tenure in the Dean of Students office, Dr. Johnson was the first African-American psychologist in the university's Counseling and Psychological Services Department, where she brought in perspectives on clinical issues students face during their college careers. Currently, Dr. Johnson serves as the advisor for the Black Student Union, fostering connections with students of color and cultivating a vibrant, engaged campus community. Together, the three of us will explore how loneliness doesn't just affect our minds, but our physical health, and especially our hearts, both literally and figuratively. And we'll discuss the steps we can take as individuals and a society to rebuild the connections that keep us healthy and whole. So whether you're tuning in alone or surrounded by others, this conversation is for you. Let's get started. Okay. Before we dive into the science of solutions, let's get personal. What's one moment in your life when you felt profoundly connected or profoundly alone? How did it shape your perspective on loneliness? I open it up.
I think that's a great question. For me, I think immediately about becoming a mother, especially for the first time. So this whole idea of just motherhood and that, it's a universal experience, but that it's also so individualistic and everybody experiences it in a very, very different way. And there's just times where you're going through things and you don't know that it's normal and you don't know what's going on and you feel like no one else understands. Whether you have a friend group who hasn't quite experienced motherhood or it's a different generation, so grandparents don't necessarily connect with what's going on. It can be hard to figure out how to navigate through that. So that really resonates with me.
Absolutely. Thank you for that insight. I can certainly relate to that. Dr. Santella?
Yeah, I'll give you a different example. During the beginning stages of COVID-19 pandemic. Now, you don't have to work in public health to kind of appreciate the toll that the pandemic had on society. I happened to be on sabbatical that semester, so I was away from my university home and community and family, and like everyone else, was home. And I felt both really connected in my home, my partner, my dog, our little family there, but also very disconnected from my family, my friends, my parents who are older and have their own health challenges. I couldn't be there. And so I felt both things. I felt really together with my own small family, but also very isolated from the people who matter most to me. So as a public health professional, I was trying to reconcile that. Like, what could I do? Because I study infectious diseases, I study public health, I should be doing something, but I'm also stuck in my condo and scared of what's happening, in the walls outside of my home. And so, just really briefly, I'll mention that, I, along with my two nieces, who at the time were middle school, sixth and eighth grade, we developed a webinar where we taught young kids, elementary, middle school kids, about viruses, COVID, what we knew at the time.
Amazing.
That knowledge was evolving literally in the moment. And so it was just kind of one small thing that I could do as a public health and infectious disease professional to kind of reconcile those conflicting feelings of being really isolated, but also feeling really connected in my home.
Absolutely. And I can relate to that as well. I think just putting out bids for connection, I think, is something that's very, natural and normal. We do it in our homes, we do it with our families, but there is a way to do it publicly. And especially when you feel helpless, like at that time in the world where we were all just trying to figure out and negotiate what our contribution was, whether it was to our home, whether it was to, the academic community, to our students, and to the public good and well-being. So I certainly relate to that. For me, it's interesting because if you were to ask anyone who knows me really well, I'm kind of a public personality. I'm extroverted, very social, sometimes gregarious. And in my community, I'm Greek American. We have a small, tight knit community. I know many people very well. And often realize that that persona, although I'm genuine, um, also can be misunderstood for things other people may think, or assume of me, um, where there are times of significant struggle that I may be undergoing, and no one would have any idea. And if I didn't make it a point to inform or to be vulnerable and open up to someone, I could very well, look outwardly very adjusted and high functioning and happy publicly, but feel really, really lonely, inside. So I think probably we all can, whether or not you're extroverted or introverted, I think we can all probably relate to kind of monitoring, how many people we let in, how do we let them in, what do we share as professionals or academics? Like boundaries are important, where's the balance in all of that? Good. Okay, so let's start with some data. Dr. Santella, the U.S. Surgeon General's 2023 advisory on the epidemic of loneliness and isolation highlights the significant public health impact of loneliness, linking it to increased risks of mental and physical health issues, including depression, anxiety, heart disease, and premature mortality. Based on the report's findings, what are some key public health implications of loneliness and social isolation? How can health professionals and policymakers address loneliness as a public health crisis?
Sure, thank you. First and foremost, thank you for having me join
Oh,
you
my
guys today.
pleasure.
It's a pleasure to be here with both of you. Before I answer the question, I'm going to use my time with the microphone this morning just to explain really briefly what is public health. Because,
Excellent.
it's one of those phrases and terms that everyone has heard of, more so because of COVID. So I'll maybe have our listeners just give them a sneak peek into what public health is. But
Excellent.
um, by definition, public health is the art and science of keeping communities and populations healthy, free from injury, disability, disease, and death. And we borrow or steal from the A to Z of disciplines to do our work, everywhere from art to history, medicine, political science, sociology, anthropology, math, zoology, theater sometimes. And so we're a very interprofessional and intersectoral profession. Our former Surgeon General, Vivek Murthy, I think was a real trailblazer when it came to kind of identifying loneliness as a true epidemic in this country. We'll talk about it later, how we compare to other countries, but this is certainly not a unique problem in the United States. And he published a report, almost 100 pages in length, probably, I think, close to 350 different credible scientific sources to back up the findings. But the data is clear. Social isolation, loneliness is linked to morbidity and mortality, people being sick and at risk for early death. And so, you mentioned some of the disease conditions that it's tied to, but it's the equivalent of smoking 15 cigarettes a day. That's
Wow.
like, the average time someone's awake having a cigarette once an hour.
Wow.
That's pretty alarming, right? Or consuming 6 alcoholic beverages a day, right? Imagine if you saw someone that you care or love having 6 drinks a day. You'd
Wow.
probably have some concern.
That's
So we need to think about loneliness and social connectivity in the same light that we think about things that are more socially acceptable, right? Like smoking or drinking. In essence, loneliness disrupts 3 major systems: biology, psychology, and behaviors. I'm just going to give you one quick example of all 3, because those 3 work
interesting.
synergistically
Hmm.
to make us not our best, healthiest selves. So when it comes to biology, it increases inflammation. Inflammation is associated with cancer, diabetes, Alzheimer's, the list goes on and on and on. It's linked to psychology, amplifying stress. We know, the toll stress has in our body, both physically and mentally. And last, it impacts our behaviors. Think about the role that things that are important to us that we often kind of push aside or sacrifice, like exercise, diet, sleep. And so when those 3 things, processes, biology, psychology, and behaviors are working synergistically, has a big toll on our bodies. So it makes sense that loneliness has this kind of manifestation to us.
I think the creepy part about that is that it's covert, right? So you may or may not see it, whereas like the drinking or the smoking, you would see. Loneliness, depending on how someone can mask it, can be a little bit more
Invisible.
yeah.
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 Mhm.
When it comes to what people can do, I think we're doing one of those things right now by talking about it, addressing it face on. I think about our role also as educators, about having this conversation in the classroom, whether that's an in-person classroom or virtual classroom. I think it's also about, as scholars and researchers, studying the issue and kind of finding creative ways of weaving it into other research agendas that maybe it's not as obvious. And then also, when it comes to policymakers and legislators, embracing what folks call connections in all policies approach. Now, as health professionals, we're always advocating for health in all policies. So whether we're talking about transportation or planning or aging, health should be woven into all those things, right? But connections in all policies, we have to think about the role of social connectivity, building social capital, addressing loneliness in everything that every person that we vote into office to represent us at the local, state, and national level can do.
That's, that's powerful. That's a really powerful way to reframe, I think. It makes me think of our schools too, where we weave technology into everything. We try to weave literacy and writing across the curriculum. Maybe it's connection that is next that we should be really reframing how people think about it and weaving it across the curriculum.
Yeah, definitely. And what comes up for me, Anthony, too, is just thinking about how our work culture has changed. So we have like a hybrid kind of state where we
Hmm.
can work from home or we're remote. And you see that people have great preference over that.
Hmm.
We don't always know why. Sometimes it's because of family. Sometimes it's because I don't want to be around a lot of people. But for the people who are coming back, for some, it's about social connectivity,
Hmm.
having in-person interactions with people that make their work life and experience more fruitful.
Absolutely. Absolutely. Excellent. Well, let's move on to the front lines in terms of our students and young people. Dr. Johnson, you work with young adults at one of the most transitional and vulnerable times in their life. What are some of the most striking ways loneliness shows up for college students today?
So just to kind of go back, Anthony, his comments kind of resonated with me. Our worlds intersect a lot
Mm.
between public health and
Mhm.
psychology. And so that social connectedness that he's speaking about and that social isolation, when we think of loneliness as psychologists, it's definitely paired. And at any given time, one can be ahead of the other. They can be there concurrently. Our data suggest, our Gallup survey, that 60% of our college students universally are experiencing loneliness or
Wow.
have experienced loneliness. And that's a pretty profound statistic. That means that more times than not, you're experiencing it at some point in your collegiate career.
Mm.
And so what I see is students experiencing issues with transitioning. So if you're a first year student and you're coming to
Mhm.
college and maybe you've moved from far away or you're a first gen student and
Mm.
you don't really have any information about what college life is like, that students kind of struggle.
Right.
And that can cause isolation. Sometimes students struggle to find social groups who am I? What am I doing here? And who am I called to be? Who am I called to be around? That can look very different from a high school community, especially if it's a small one. Another thing that we see is social pressure. So pressure to drink, the pressure to experiment with drugs, the pressure to go out and party and do different things that maybe you were not doing prior to getting to college. Because in some respect, they're emerging adults, but they're weaning out of that adolescence. And we keep pushing that age further and further up. I think we're at 26 now in terms of the brain being fully developed, that prefrontal cortex.
Right.
And so these things manifest themselves while students are experiencing these different concerns. Increased use of technology. I'd rather just use a social platform to engage with people behind the scenes because maybe I am introverted or have a social anxiety. And so I'm not so likely to go out and engage in an activity on campus or go to a sporting event on campus. Also just hiding behind, I don't really care for who I am. So I'd rather put something else out there. I don't want people to think I'm a loner. But look at all this activity that I have surrounding me, that I could kind of put that narrative out there for students to see.
You know, you triggered something in me now. And it's this whole new culture of relationships. And I can say this to both of you, like, you know, where they might not be as committed or might not be as deep, or these situationships or whatever.
They're superficial.
They're right. And it makes me think of like when I was a college student, right? Like relationships obviously were everything at that time, trying to bond and form. It looks like the culture has completely changed around that. So as a young person, even as an older person, actually, if you're in the scene where you're seeking a partner, like it's the expectations are completely different. And many
Definitely.
times they're undefined, right? Which for me would feel very like precarious.
Yeah. So even for dating, which I'm glad you mentioned, I mean, a lot of people are turning to social media platforms instead of like going to church and finding that person or seeing them out at a restaurant or that kind of thing. And I think our approach to dating and finding and securing relationships has definitely shifted in, especially in our college students.
It's funny, some of the examples you mentioned, because I was thinking about my own experience, and I was like, oh my, I think I'm starting to sweat about this. But, you know, I went to college in the late 90s. I didn't have a cell phone until I think my junior year of college. And it was one of those flip phones where it wasn't really worth texting because, you know, it took, 5 minutes to write a sentence. But so you kind of were forced to interact with people or not, right? Um, and just last week, I saw a group of students who I know who were kind of just hanging out at a table in, in the hallway of the building. So I went up to just chit chat, and they were all on their phones texting. I was like, "Oh, what is just making chit chat?" I'm like, "Oh, we're just texting each other," and I was like, "What?" And part of it, I think they didn't want people to hear their conversation.
Okay.
But they're like, it's quicker and easier. And I was like, but you're right here. They were like
Right.
this far apart as we are right now. So it just gave me flashbacks. I was like, that would not even been an option when I went to college. And I don't think I went to college that long ago. Maybe for them, it's probably before they were born. But so it's funny how things change and the tide turns when it comes to how we engage with each other.
Right. And then what it does and the correlation to other, health variables, right, that are so protective, right, that we had blindly protective, I think. And now it's that you have to be very, very careful about understanding that you do need to go a little deeper. If you want to reap the health benefits of what connection has to offer as a protective variable, then you have to be able to connect deeply with another person, or else you're not going to reap those benefits, right?
And I think our emerging adults don't quite make that connection, that it can lead to mental health concerns. So staying in a perpetual state of loneliness can lead to anxiety, depression. But when you're in it, you'd rather kind of just sit with that than to kind of go outside of yourself to try to navigate it, because there's things that are getting in the way of that. And I think that's why these types of conversations are so important,
Right.
just
Absolutely.
to normalize the experience that this loneliness is not a respecter of persons. We're all susceptible to that. So
And I think it's akin to if you grew up in a city, right, that has high pollution and you live in the city, and then you vacation or holiday somewhere that is more rural or on a mountain or whatever, and you breathe the fresh air, you realize in that moment that, wow, this is significantly different than what I'm used to, because when we're in a culture of whatever we're in our whatever our MO is, it becomes the normative, right? So
Right.
sometimes we don't even realize
Right.
that that's what we're sitting in
Right.
until you're able to have an experience, right? That shows you something contrasting,
Yes.
right? Very interesting. So along the same lines, um, social media, right? It's supposed to connect us, but it's also linked to heightened loneliness. So how do students talk about their online worlds, um, either in your classrooms, in your counseling settings, or as a student life body?
Well, I could speak a little bit about the graduate student
Sure.
experience where, we encourage social media platforms for networking, which is great for a graduate student who's trying to get into a new field, who needs to make connections, who needs to secure an internship or a job. So we definitely um, highlight the benefits of it. We're also careful to be able to model good behavior, including just like the social media platforms that our program or even university
Mm,
uses, to ensure that what we're putting out there is the same kind of message and content that we want our students to do. There's a lot of misinformation, disinformation
yes.
about there. So I also think about in the role for public health professionals in terms of right? Looking at content, not believing everything you read,
Hmm.
looking for the sources. Is it credible? I just had someone on Friday say to me, "Oh, I heard," and they rattled something off. I was like, "Where did you hear that from?"
Mm,
And it was something that I knew I wasn't too sure about. It was related to like new bird flu epidemic, and I was like, "What's the source? Who did you hear from?" Oh, social media. What does that mean, right?
yes,
So I think we have to be careful, right? It's out there. We want people to use it. We want people to be responsible users
absolutely.
of social media. So we can't ignore it, but we also have to kind of acknowledge its limitations. I also think, as I'm sure happens with undergraduate students, high school students, really across the age spectrum, is it's a distraction.
Mm,
And I think for some students, they also start questioning their own intentions. It may bring up feelings of imposter syndrome,
hmm.
right? So I think we have to acknowledge it, address it head on. And I'm certainly not a social media expert, but I know for myself, one of my, I don't believe in resolutions too much, but I did think a lot about it this year, is to take a news and social media diet. But just
Mm,
like I care about what I consume in terms
yes,
of food and beverage, I also want to care about what I consume with social media and the news.
absolutely. Dr.
Definitely.
Jackson.
Yes, I agree with you. I think it's a double-edged sword.
Hmm.
So we see students engaging and using the app to connect with campus community all of the time. Obviously, aside from the social media aspect, the technology to reach out for resources and all of those types of things. But the one thing that comes up for me that I see our students experiencing is somewhat related to bullying. So
Mm,
on certain apps that they're using, on certain other social media platforms,
even at the college
even
level.
at the college level.
Wow.
Yeah.
Mm,
I mean, this is still a very sensitive, critical
hmm.
stage of development. And I think that our college students just think it's fun or funny, and they don't realize the impact that it has on that person on the receiving end. And
Mm,
so I've witnessed a number of different types of issues, concerns with the platform where students are antagonized, they're made fun
mm,
of, they're followed, they're ridiculed. And that lead to loneliness because
yeah,
of course you're like,
disconnection.
oh my goodness, not just one person knows this, but like the whole campus community. I mean, that's
Mm,
like life changing. We have students who are like, I'm out of here. I don't want to deal with this. And so how do we help mend them and build them back up?
yeah.
Um, and the social comparison is another big piece. And I think institutionally, I see this as well, where students are following social media platforms and they're seeing how maybe even college friends across the way are living.
Yes.
Like, oh my gosh, they're having so much more fun. They're
Mm,
partying. I have no friends. Like I'm by myself. I don't have that kind of social capital. Who am I? And that lead to some mental health concerns
hmm.
or this narrative that people put out that, oh, I have this, I have that. And in reality, it's just what you want people to see. It's not really what they're experiencing. And that
Correct.
lead people to loneliness because like, I feel bad about my life and I don't have that and I want it. And how do I get it?
Right. And I think we're susceptible as adults, right? I think that I know that I noticed this as someone who really enjoys social media for the benefits that it offers, that, if it's a summer vacation that I'm not able to do what I want to do for work or other restrictions. And I start seeing my feed flooded with images of families on vacations. Like it's a ding. Like I feel it. I don't want to feel it. Right. So I think that even as adults, like, and it all trickles down to the students and to our children below us, because how we regulate and how we feel, right? It influenced then how we behave and how we speak to them. And it's all interconnected really as
Absolutely.
well.
And I'm not a social media expert either, but I mean, you've looked at things on social media after you've said something, and then it's coming up in your newsfeed and you're like, how does it know? And I think
It
that,
knows.
yeah, it knows. I think it's knowing more as time goes
Absolutely.
on. And that also fuels the fire for those emotions and feelings and thoughts that that person's having that's following
Yep. And
what they're being fed.
you can make a mistake and it could live somewhere for a very long time. Where we were
Absolutely.
silly kids, really, how much evidence of the silliness do you have?
Right.
And it wasn't broadcasted or right
Right.
now it's so instant. Even a bystander will take out their phone if
Yep.
they see something that's
Yep.
interested, funny, and so forth. And
Yes.
so a whole different mentality. So as we're we're having a great conversation and time is flying. So let's shift to the next question. How does loneliness extend beyond the individual to impact an entire communities and systems? Are there ripple effects that we don't talk about? And is this uniquely an American problem? Dr. Santella,
Yeah. So higher social connectivity is without a doubt yields better community outcomes. There's lots of examples, including communities that have higher social connectivity have are able to combat violence through community safety. They're able to combat natural disasters through resilience. They are known to have less unemployment, more prosperous, and they tend to have more representative governments because they're more civically engaged. So without a doubt, social connectedness yields better community outcomes. Also, just give you a quick example from the community I work most closely with, which are people with HIV. HIV has been around for decades, yet people with HIV continue to face stigma and discrimination because of their disease. However, the research shows that people with HIV who have higher social capital, right, that value we get out of relationships, are able to buffer that stigma, discrimination, much more so than people who don't have high levels of social capital. So, like I said, the science is there, and I think as health professionals and as just professionals in general, we should be following the science. To the
who does it right? Like if you had to think of a country or someone that would be high,
Yeah.
is there one that comes to mind for you?
So there are, I'd say, three really cool examples. And I was thinking a lot about this. One is the UK. So the UK, back in 2018, created a new federal position, the Minister for Loneliness. So imagine, like, we have the Secretary of Defense, Labor, Interior, Health and Human Services. Imagine if we had a secretary dedicated for loneliness in this country. So they've clearly taken a national issue and have given it the resources that they need to be successful.
That's tremendous.
Another country that has done more is Italy. So the Italian government has recognized social isolation and loneliness amongst older people, the elderly. And so they're incentivizing younger people to cohabitate, be roomies with an older person so that they can afford to now live on their own and have more affordable rent mortgage by helping provide that kind of connection with an older person. And then the third example I would give is from Japan. Japan, again, the federal government has recognized that young adult and adolescent withdrawal from society is so prevalent, they've given it a name. I'm probably going to butcher it, but I believe it's called hikikomori. And hikikomori is the phrase they use for withdrawal from society by young people and adolescents. It's so prevalent that they've given it a name.
Wow. Huh.
Yeah.
Excellent. That's really wow, that's really powerful. I learned something for
We've got
sure.
some work to do in this country.
Absolutely. And so let's see. Why don't we talk about some creative interventions? We don't have a lot of time left. I wish we had more. What's one unconventional or surprising technique you've seen help students reconnect, either with themselves or others? Or what does a breakout moment look like for someone, student, young adult, young person or anyone really struggling with loneliness?
I think getting a student, especially in this time, to try something that they've never tried
Mm,
before has worked wonders. As soon as you get them hooked in, you start to see the benefits. So
right.
just trying something that they've never done before can be really beneficial, as well as getting them engaged in community service. There's something about helping others
Yes.
that helps people to put their own stuff into perspective and help them to get out there to better navigate their loneliness.
Absolutely.
So I teach in a online program. So I worry about loneliness and lack of connection with classmates and faculty a lot because in an asynchronous program where you're on Zoom at
Yes.
your convenience. So one strategy that I encourage our students, and I think this can work for anyone, whether you're in an in-person online program, is academic co-working. So I tell students, find a study buddy in the class, carve out, let's say 90 minutes. You're going to get on Zoom, you're going to work on assignment X, right? The paper, the literature review, for example. You're going to work for 20 minutes independently and then take a 5-minute break and chit chat. You're going to work for 20
Mm,
minutes and then chit chat for 5 minutes. And by the end of the 90 minutes, you've gotten about 60, 70, 75 minutes of work done, and you've gotten about 20 minutes of that conversation. You get to know your classmate a little bit better, and you're still getting your work done. So that kind of academic co-working, I do it with my own colleagues sometimes. Like, we have to hold ourselves accountable to getting this grant written or this paper
yes.
written or this
Right.
whatever done. Let's just jump on and we'll, have some fun time and then, study time.
And
Very
to know that there's
strategic and
someone there,
yeah,
right? And
very
there's someone with you.
yeah, I'm sorry.
Yes.
Very strategic and very prescriptive. And
Right.
then they can
Yes.
continue to build from there.
Absolutely.
Exactly.
So let's stop for a listener challenge really quickly. Let's pause for a moment and ask our audience, our listeners, when was the last time you reached out to someone, not for a task or for an agenda, but just to say that you care? Text that person right now. Go ahead and do it. We'll wait, and we'll do it with you. I wonder what people are saying and feeling while they're doing this. So as we come to a close, what's one thing listeners can do this week to connect more deeply with others or with themselves? Like if we were to meet again in 10 years, how would you hope the conversation around loneliness would be different? What does a more connected future look like?
Well, I hope that maybe some of the examples I gave from other countries,
Yes.
I can include the US and our response in kind of addressing this head on, just like we've done with heart disease and cancer and
Mm-hmm.
HIV. We take on loneliness as a true epidemic.
Right.
I think destigmatizing mental health overall would be helpful, that people are not fearful to go and get counseling services. That doesn't mean that you're crazy or that there's something wrong or
Yes.
odd about you. I think it has a lot of benefits, but also having students have more gratitude for what they have, who they are, and really build up that self-esteem so that they have the confidence that they need in those moments where they feel lonely, that they can navigate it and move forward.
Right. So you mean like a gratitude kind of intervention or some kind of mindful
Absolutely.
routine that they're engaging in that
Yep.
helps them scan the environment and recall the pure moments of joy or goodness in the
Yes.
day.
Yes.
Yeah, very powerful. And science tells us a lot about that and the health benefits of that. So, okay, as we wrap up today's conversation, I want to leave you with this thought. Loneliness is not a flaw and it's not a failure. It's a signal, a deeply human one, that we are wired for connection. It's a reminder that even in a world of constant notifications, likes, and virtual meetings, what we really crave is meaningful connection. We've learned today that loneliness isn't just a personal struggle. It's a public health issue, one that impacts our mental, emotional, and even physical well-being. But we've also heard that the solutions don't have to be complicated. Sometimes it's as simple as reaching out, checking in, or even making space for someone to feel seen. Whether you're an educator, a student, a parent, or just someone navigating this fast-paced world, remember, small moments of connection can have a big impact. And it starts with each of us. If today's episode resonated with you, I encourage you to share it with someone because chances are they might be feeling the same way. And if you're struggling with loneliness yourself, know that you're not alone in the feeling and that support is out there. Thank you to our incredible guests sharing their insights and experiences. And thank you to you for joining us in this important conversation. Until next time, I'm Dr. Evelyn Bilias-Lolis, reminding you that even in the loneliest moments, connection isn't out of reach. It often begins with just one small step. Stay tuned and we'll be back with more conversations on mental health, education, and building stronger communities. Stay connected, and we'll see you next time on the Dean's Dialogue series.